Hi, my name is Darren Paris, and I'm speaking to you on behalf of TrueAccess Vendor Credentialing. I appreciate the opportunity to talk with you about this product and a potential partnership with WCPC. I'd like to thank Lindsay for inviting me to do this. I know your time is limited, and I'll try and keep this as concise as possible. We are a Tucson-based company. We've spent the past 4 years with a team of 7 developers and engineers building a novel vendor management platform. It's patented, FCC certified, and has been operational for just over 2 years at TMC, more recently at Eminent Health, and we're beginning to grow. By way of a background, the federal government and states require exclusion testing to identify vendors barred from Medicare and Medicaid at the risk of non-payment and fines to hospitals. The CDC has specific recommendations for people who work in healthcare facilities. The Joint Commission has expectations regarding vendor management that are less well defined, but nonetheless are subject of audits. What we offer are innovative changes in how we manage vendor access to healthcare facilities to provide a better experience for all users, a more reliable process, and a new source of revenue for hospitals. We consider vendors as necessary partners in healthcare delivery. Many procedures we do in cath labs and ORs require their product expertise and could not be done safely without them. We do, however, have a reasonable expectation that, like hospital employees and physicians, vendors are credentialed, vaccinated, and have basic training in areas such as HIPAA and sterile technique. The challenges being how to ensure that vendors who work in your hospital meet these requirements in a simple and reliable way. To give you an overview of our system, vendors register, upload required documents, and sign a hospital's policies electronically, either with their mobile app or on our website. This is straightforward and it's easy to do. We confirm their identity, verify that they don't appear on published exclusion lists, review their documents, and mail them a smart badge. The smart badge is the first thing that sets us apart. This is what it looks like. It's lightweight. It's provided with a clip or with a lanyard. It has a rechargeable battery and an LED light to indicate a vendor status at the hospital. Access with this badge is fully automated and cloud-based, achieving our goals of simplicity and efficacy. When vendors enter the facility's perimeter, which is known as a geofence, so this is a virtual perimeter, they are checked in automatically. The system does not rely on vendors to voluntarily check in or out. Inside the hospital, if their credentialing is current, the badge light turns green. If not, it turns red and the hospital is notified by email. The badge is easy to see and easy to interpret. It's either red or green. Vendors just walk in, just walk out. They don't have to look for or stop at a kiosk, which is why anecdotally they prefer the system, and a formal survey is currently being conducted. At the same time, automatic data capture increases reliability. The net result is a system that's easier for vendors to use, that at the same time holds them more accountable and provides a more accurate record of vendor activity. The hospital website has all the features you would typically have and expect. This is a sample of what it would look like. You have your list of vendors. You can query this list in any way. You can look for a specific person, anybody that belongs to a specific company, anybody that was in the hospital on a given day or date range. You can generate reports either in PDF or as a CSV file. You can look at unapproved entry, which is a list of people who have come into the hospital when they should not have. The new vendor list gives you the names and company names of vendors who have signed up within the last month. Vendors can request appointments with hospital administrators through the system, and the hospital can manage its internal policies easily by selecting policies and selecting or dragging a PDF into a box. The policy would then be disseminated to all vendors who would be required to electronically sign it before they had access to the hospital. There's a number of other reports that can also be generated. So this is what you would expect. Beyond this, we have a system called Vendor View. And this is an intuitive and very visual system with a number of different functions. For example, if you're at the front desk of the hospital with this tablet set in a tablet stand, you would know who a vendor was before they arrived. So as somebody approached the desk, the person standing there would see their profile picture, their name, their company name, and if they had valid access to the hospital. If the vendor view was positioned in the OR, as they approached the OR, you would see the same thing and you would know if they had valid access to the OR. Same for the cath lab or any other area that you consider sensitive and worth monitoring regionally. The tablet also has a directory of vendors allowing you to communicate easily. You can create a list of favorites, so the usual vendors in the cath lab, the usual vendors in the OR. You can notify somebody of an upcoming procedure. If you don't know who you're looking for, you could search, for example, for a Boston Scientific pacemaker rep who you might need to come and reprogram a pacemaker before surgery. The system allows you to see who's in the hospital currently, who's in the OR, who's in the cath lab, and it provides a record of access to these departments. In the future, it will provide room-level real-time location using Bluetooth, and that's being developed. I can show you what it looks like. So this is currently what's going on at TMC. So there are 5 vendors who are currently in the facility. You can see who they are, who they work for, and you can see their status at the hospital. It's relatively late at night, but earlier today there were many more vendors there. This is a list of vendors who visited the hospital today, which you can see either as a list view or a badge view. This is badge view, and it shows you the same data, but more visually. You can select a vendor. So this shows the vendor and their history of visits to the hospital. He's favorited. You could contact him if you liked by typing a message into the screen. And that would send a notification to the vendor's phone and also an email. You can look at people who visited the hospital without access today. So this person's tuberculosis test is expired. The directory allows you to look people up, as explained previously, and there's a few other functions. The system is available, as I said, on a tablet, and soon will be available in an app version that hospital administrators could have and access via their phones. We are open to a fee share, 22% of the subscription fee paid quarterly to the hospital and 3% to WCPC. That's a summary of what I had to say. We could speak in more detail if necessary. Thank you very much for your attention. We look forward to working with you. Thanks a lot.